Okay, so I'm hitting record. We do record our webinars when possible, and so this one will be recorded and will be uploaded to ICODVA's YouTube page so that you can watch it in the future or send other coworkers who might have missed it to watch it. And I'm going to go ahead and get started. So this topic is suggested because this is one of the focuses of the coalition in the last year or 2 years, where we have taken a step back and tried to take a look at what really works and what doesn't. The funny thing is that there is always a big gap, I think, in any field between what we know and what we want, what we know and policy. When I think of there's lots that we know about education and how children learn, but our schools are not necessarily built or operate or certainly funded along those lines. And the same thing could be said about our criminal justice system. And given our focus of domestic violence, this should be a place where we spend some time thinking and really taking a look at what we actually know. So what do we know about stopping crime, whether it's making it so that people who have never offended don't start, or if you have somebody who has offended in the past, so they don't reoffend. That's kind of what I want to focus on. And so I'm gonna start by saying, yay, the United States is #1. We have the highest incarceration rate in the world. By far, we have less than 5% of the world's population, but we have 1/4 of its prisoners. We have 41,000 inmates that are currently serving life sentences, and in comparison, England has 41,055. I understand that England is a smaller place, a smaller population, but if you adjusted for the UK population, they would have 275 compared to our 41,000. There are hundreds of thousands of people who are released from U.S. prisons every year, and then they try and make a go of it in a world where they essentially failed before. And now they have the added disadvantage of a prison record. So more than 2/3 will be rearrested within 3 years, and half of those will go back to prison. This is not the way we have always been. In the 1970s, the U.S. incarceration rate was 1/5 of the level that it is today. Then there was some significant changes in our sentencing laws, in some of our policing practices. We had a lot of tough on crime laws that passed at both the state and the federal level with bipartisan support. That's one of the few things that the Democrats and Republicans have been able to agree on in the last couple decades. And we had this huge explosion of incarceration. And the ironic thing is that that has been true even though violent crime, and actually all crime, has been on a significant downward course over the same decades. So incarceration rates, arrest rates, everything going up at the same time that crime is significantly decreasing. So let's back up a little bit as a foundation and talk about what goes into a criminal act. And there's 3 parts that it's sometimes helpful to think about when you think about preventing crime. And I'm going to go through these one-on-one. The first one is access. In other words, you have to be able to get to something in order to do something. When we think of domestic violence, the person that you have the most access to is your intimate partner. You know everything about them. You know where they are. You know all of their passwords maybe, or you know where their parents are. Or, you know so much about them. You have tons of access. And so that's what gives you the opportunity to do those things. And when we think about how we've stopped crime in general and how we've tried to focus on stopping domestic violence, often it is about preventing access. We put in security systems, we put in bars on windows, we take people out of the population and we lock them up. There's lots of things that we do. We take survivors out of the population and we hide them. There's lots of things that we do to try and prevent access as crime prevention. Second part of any criminal act is essentially the will to do it. The impetus is really the force that makes something happen or something happen more quickly. So think of it as motivation or stimulus. I could have something, I could walk past a jewelry store every single day and never actually decide to rob it until something happens, and now I have an impetus to do that. Now I lost my job, I can't feed my kids, we're going to be evicted, I feel desperate, and there's an impetus there that's added that makes me more likely to do it. And so here you're largely talking about sometimes some counseling issues if you're talking about domestic violence. I want to make it very clear that impetus and provocation are not the same thing. The jewelry store window doesn't provoke me by being there. I just have never had the motive, often. If you're a mystery buff like myself, what's the motive? You got to find the motive. Impetus in some cases might be more like motive, but it isn't provocation. Then there's disinhibition, and we are all inhibited from doing antisocial things. All of our social rules are there to control behavior and make society function, and so that acts to inhibit our behaviors. A disinhibitor takes those inhibitions away. So things like fake cameras, things like bars, things that would make it so, oh, I'm not going to commit a crime here because I'm inhibited. If you remove those things, the theory is that crime is more likely to happen. So we have seen like Mothers Against Drunk Driving. Spend a lot of time working on social messaging and social signaling to make it so that it's no longer okay, it's no longer funny to drink and drive. Have lots of campaigns to make it so that people will intervene and stop a friend from drinking and driving. That's about increasing the inhibitions. One of the common things that you hear from people who say, oh, well, the only reason I committed this crime, the only reason I batter, you name it, is because of alcohol or other drugs. One of the common counters to that is something like, well, if you only do it when drunk and you can't control your behavior when you're drunk, how many drinks would it take to French kiss your grandparent? And if the answer is, I would never do that no matter how much alcohol was in my system, then okay, even under the influence, there are belief systems that are guiding your behavior. There's some things you will and will not do. So apparently, at some level, you think it is okay to batter your partner. If we take that out to a larger level and think about what are the aspects of our society that take away inhibitions to abuse partners, particularly women, what is the social messaging around that? It becomes very clear that there's a lot of disinhibitors in U.S. society towards violence in general and in particular to make it so that it's okay to use violence against women. Now, one of the kind of outcomes of this kind of thought is sometimes called broken windows policing, and that is based on some work done by George Kelling and James Wilson in the early 80s. And basically what they were saying, their theory was that that there's social signaling that goes on where social controls are removed, starting small. So small vandalism, broken windows, littered streets, things like that lead to a larger sense of community, communities falling apart, urban decay. It makes it so that the disorder leads to increased fear and withdrawal from residents in a community, and then that allows more serious crime to move in because those informal social controls are gone. So what they were proposing is that police can play a key role in disrupting that process by focusing on the early bits of it, the disorder, less serious crimes. If you dealt with broken windows then at the start, then you wouldn't have to worry about massive drug dealing later on. You would reduce fear and resident withdrawal from those communities. So that was what they proposed. However, that whole idea was used to justify stop and frisk policing when, of course, the people that were stopped and frisked were often people of color, and zero tolerance policies that are also used disproportionately against people of color. Now, more recently, the same people, Kelling and Company, have said, hey, that's never what we meant, and they describe a more community-oriented approach to partnering with residents and community groups to tackle disorder collectively as opposed to from a policing kind of model. But nevertheless, that's how their work was used, and kind of the measures, the tools that they were using in their early work was the number of kind of misdemeanor arrests that were made. So there you go. Best intentions or not best intentions, that was the result. So what we have is, as I said, a tremendous disparity in how these kinds of philosophies or policies or theories of crime and punishment have been put into place, which just shows you that things that might from the outside or without much deep thought appear to be race neutral actually are not when put into place. I'm going to talk a bit more about disproportionate minority contact, which is a lovely way of phrasing it, disproportionate minority contact, as we go, but just tuck this idea aside for now, because I want to just talk generally first about punishment. Punishment in its most basic definition is a consequence that you deliver, or if it's you, the target, you receive after a behavior to make you stop doing that behavior, right? Or at least reduce doing that behavior. And the consequence can either be taking away something you like, taking away something good, or giving you something that's not desirable, or doing something to you that's not desirable. So it can work either way. It's still punishment. And we have known for a long time, if you can go back to very early research on punishment and reward systems. We've known for a long time that punishment is not necessarily the best method. So does punishment work? Well, when you say punishment, what do you mean? What does that mean within the context of our criminal justice system? And how are you measuring whether or not it works? And one thing is very clear, and this is why I said there is such a huge difference between what we know often and what we do. Most of us were raised with an idea of punishment as what you're supposed to do and what works. It has been passed down from generation to generation. There are so many people who will still say, well, I was spanked and I turned out fine and I raised my kids the way I was raised, and that, you know, punishment, and they're thinking spanking is a great thing. We are surrounded by punishment strategies to influence and control our behavior. When you keep a library book too long, you get fined. If your dog is out without a license, you get fined. You park too long, you get fined. There's fines and penalties and reprimands and all of that whirling around us all the time. Punishment is what we know as a way to control behavior, and so to give up punishment as our primary tool we often feel left empty-handed, and that's kind of the response you will often get when you talk to a parent about, well, instead of spanking, how about trying some of these other parenting strategies? And they look at you like you're crazy, or they're so uncomfortable with trying those because we live in a world of punishment. Public opinion strongly supports the increased use of prisons, thinks in terms of criminals need to get their just desserts. Punishment is the primary justification for sentencing, for increasing sentencing. The vast majority of the public believes that you should just take criminals and lock them up forever in order to prevent future crime. And again, most people believe that courts are way too easy on criminals and that prison is way too fun for criminals. It's way too nice, not punishing enough. Let's take a look for a second at our correctional system. And when you, again, just look at the basics of what does a correctional system say their goals are, what are they supposed to do? In general, it's these four things: deter crime, incapacitate people so they can't commit crime again, retribution, just punishment for the crime, and rehabilitation. It's definitely worth it, and so we are going to take a look at each one of these and say, how well does what we're doing actually accomplish those goals? And the first thing is deterrence. Does jail, does prison make it so that you don't commit crimes? And my answer to that would be, we have Memorial Day coming up, right? And you're going to drive and visit family. So what would make it more likely that you stick to the speed limit? Are you going to stick to the speed limit because you are going to, because you know that the fine if you speed is going to be $200? Is that going to make you stick to the speed limit? Or are you going to stick to the speed limit because you see that they have tripled the number of cop cars out there and highway patrol out there to catch speeders? That's actually probably what's going to make you slow down. You're probably not going to get in the car and think about how much you might pay if you got caught and therefore stick to the speed limit. But the first time you go by and you go, whoa, I need to slow down a little because they're out in force today, that's what changes your behavior. And that's what our research on deterrence has shown. If criminals think there's a slim chance they'll get caught, the severity of the punishment is just not an effective deterrent. It's absolutely about increasing the perception, oh, I will be caught. Strategies that use police as sentinels, like hotspot policing, those can be effective. And one of the reasons for this is that people know very little about the sanctions for specific crimes. You might know what the mandatory minimum penalty is for a domestic violence serious misdemeanor, but I'm guessing that 99% of the people on the street do not. Seeing a cop there in their car with a radio or with a speed gun, that's going to influence your behavior far more than if they doubled or tripled the fine on speeding. The deterrence argument is really based on an assumption that offenders are like pure, rational, cost-benefit calculators, that they're operating purely out of self-interest. And that's not true. There's a variety of motivations that shape criminal activity, everything from personality traits, social learning, deprivation, subcultural meaning, political conflict, social conflict, you name it. What actually happens is, rather than prison being a deterrent, sending people to prison can have the opposite effect. Inmates learn more effective crime strategies from each other, and time spent in prison can actually desensitize people to the threat of future imprisonment. What seems to work best is kind of low to moderate punishment combined with a moderate to high certainty of apprehension. Increased certainty of apprehension, that's going to change people's behavior. Incapacitation, that was another big goal of our correctional system. We'll just separate people from society. We'll prevent access. One of the things about this is it is true, you can separate people. It doesn't necessarily prevent access, however. There are people who not only, you have clients who go and visit their perpetrator while their perpetrator is in prison, whose perpetrator writes them letters, whose perpetrator has family and friends that monitor your client and send reports about what your client is doing to that person. That perpetrator can get other people on the outside to intervene and act on their behalf against your clients. You have people who want to maintain those relationships. It it prevents some like direct physical access, but there's still a lot that people can do even when they are physically separated by a building, right? The other thing about just focusing on incapacitation, well, there's actually two things. One is it really just kicks the problem down the road a bit. So it's kind of like, well, okay, I've been victimized by this person. I need my window of safety, which might be true, but the fact is they are going to be released in the future, and if incapacitation does nothing to stop them from reoffending, then people are still at risk, including myself, when they do eventually get out, whether they get out in 3 years or 5 years or 10 years. So it gives a kind of a false sense of security, and to say, well, we'll just permanently incapacitate people and we'll put them away. That's 1.5 to 2 million inmates. And if you just take out the violent, in state prisons, about half of those inmates are there for violent crimes. About roughly 20% are in there for drug offenses. Still, half of 1.5 to 2 million people is a lot of people to incarcerate for the rest of their lives. Retribution. Oh boy. This is absolutely one of the reasons why we have our correctional system. I don't know if punishment or the desire for revenge is hardwired into us as human beings, but we certainly have a criminal justice system that is a system of retribution justice. We want to inflict pain on people who have harmed us or our loved ones. And the problem then often is that sometimes we'll leave offenders feeling like then they have become victimized and they want to seek their own revenge. This is kind of a Hatfield and McCoy scenario. So unless we execute people or put them away for life, we have to remember that they'll eventually come back to us. And if they come back to us now having felt victimized by the system that they were put into, again, is that really going to decrease the likelihood that they might reoffend, or is that going to increase their antisocial sense and their isolation, increase their anger and their probability that they may engage in crime and maybe even switch to violent crime where it was not violent crime before. And yet, the public and often politicians, very often politicians, constantly talk about getting tougher on crime, and by that they mean more punishment, more prisons. You know, one more thing about punishment. If you even go back to like Skinner and his work on operant conditioning and such, we do know it. As I said, mild punishment can effectively change behavior. particularly if it is frequently applied, it's immediately applied. In other words, you do this, this immediately happens. That's not something that happens in our criminal justice system. You do this, and a year from now, you go to jail. And if the punishment is followed with positive reinforcement of some kind of the behavior that you want. Punishment, especially just punishment, and particularly in its severe form, again, we know it makes people tend to want to avoid or escape. It alienates people. People become more aggressive. It can cause fear that generalizes to other things. So like if I have a teacher that punishes me at school, I might have just a generalized fear of school. I might drop out of school. Now I am, again, isolated. I'm not as able to hook into my community. There's unemployment issues. Um, I'm set up with a lot of other risk factors that make it more likely that I will offend. Punishment behavior often reproduces punishment. In other words, it teaches people that aggression is how you cope with problems. Punished behavior is never forgotten. It's really just suppressed, and that behavior returns whenever the fear of punishment isn't there. Okay, so enough about punishment and retribution. Let's talk about rehabilitation. Hopefully that is another goal of our correction system. And again, the difference between knowledge and our practice, research has pretty consistently shown that time spent in prison does not successfully rehabilitate most inmates. Most prisoners will learn new and better ways to commit crimes. For people who were low-level offenders to start with, being in prison often essentially overdoses treatment to them, and they come out worse. They make connections. Because they've become separated from their previous connections, human beings don't hang around separated for long. So the new connections they make are new connections that involve them more deeply in the criminal world, if you will, criminal communities. They're disconnected from their support systems, and the skills that they need to survive in a prison environment, the kind of adaptive behavior required in prison, is completely maladaptive behavior outside of prison. I think the misogyny in prison is particularly relevant when we're talking about violence against women issues. In other words, prison is not a good place to learn respect for women. It is a tremendous power and control environment. It can often be traumatic to experience it, and so there's not a lot of you're not going to learn a lot of partnership behaviors and about equality and social justice and whatever within that kind of environment. It'd be like trying to hold all of your AA groups in bars. That's not the best place to be trying to do that sobriety work. Now, if we take a look at community programs as opposed to prison, it becomes a little bit more complex and more interesting. Community programs can actually be more effective and cheaper than prison. So when the good things happen within correctional programming, it is usually within community-based settings. However, the other side of that coin is that it can bring more people under state control. Recidivism rates of community corrections are lower than those of prison inmates. In some cases, costs are cheaper. In some cases, it depends on what community program and what piece of research you're looking at. Intensive supervision without treatment doesn't really affect recidivism in prison or in community programs. If you have intensive supervision and community programming that is responsive, that uses interventions that are geared specifically toward, and instead of one size fits all, but that offender's abilities and their motivation. There can be up to a 16% reduction in recidivism. 16%, woo-woo, that's a good outcome in comparison to some of the other outcomes. Here in Iowa, in Polk County, there is a evidence-based, researched and proven program for community-based probation. It's only for the most high-risk offenders. They are intensively supervised. They have probation officers who have specialized training and who have reduced caseloads. And those probation officers have specialized caseloads. So like, this person is a domestic violence probation officer, and this person is a sex offender probation officer, and things like that. They do comprehensive case management. You know, this person has mental health needs. This person has substance abuse treatment needs. This person needs to get their GED and needs to get work on some job skills. So they target those kinds of needs with services. They do not target other non-criminogenic, non-crime producing factors like self-esteem issues or emotional problems, unless those problems are acting as a barrier to those other kinds of education and treatment. And it tries to be flexible and responsive to that offender's mode and level of motivation and to their learning style and things like that. So by getting outside of the one size fits all and focusing not just on punishment, but instead looking at what does this person really need and how can we hold them accountable and at the same time give them those things, that has produced some good results. If we think about prevention in general and we go back to kind of the Centers for Disease Control prevention model that you're probably very familiar with, the way that you change behaviors in communities, the ways that you shift towards more healthy practices is you strengthen the protective factors that are in communities while at the same time reducing risk factors for folks, and that moves the situation along towards the desired change. So what I've talked about so far has kind of been looking at really tertiary, secondary or tertiary prevention after, you know, what do we do rehabilitation-wise after people have commit crimes, or what are we doing that now we're knowing doesn't work? If we look a little earlier and think in terms of what are those risk factors and those protective factors, all across the board we can look at, you know, at the individual and family and community level. There's individual things, aggression, particularly if it's early, antisocial beliefs and attitudes, impulsivity, low verbal abilities. All of those things kind of at the individual level can act as risk factors for somebody. People who have trouble with school, they have trouble learning, they aren't attending regularly, people who have been suspended, people who have been truant, people who've dropped out, people who aren't bonded to their school community, folks with learning disabilities. All of those things are huge risk factors. And so what you see later down in the line is prisons often acting as the reschooling places for people who did not succeed for one reason or another in our schools out in the community as children. And so then in prison, what's one of the first things is, well, let's get you through high school. Relationships is a huge issue, whether you're talking family or community. So are there other people who have been to prison who are in the immediate family? Is the child, have there been lots of family disruptions? That could be domestic violence. It could be repeated homelessness. It could be other kinds of family disruptions, mental illness, substance abuse with the parents, lack of adult supervision, harsh or inconsistent discipline, lack of parent support, gang involvement, other kind of peer associations or being bullied, peer rejection. Then we have issues, traumatic issues and substance abuse and mental health issues. About 56% of U.S. inmates overall have mental illnesses. So essentially what has happened is we got rid of our public mental health facilities and in many of our community mental health facilities as the primary places where people receive treatment for mental illness, and we moved that over to our jails and our prisons. The medical community has decided that addiction is a disease, and the criminal justice community considers it to be a crime. And we have done all these things without stopping and saying, you know, from a prevention perspective, how do we keep children from growing up in communities where selling drugs is their best career option? You know, what's going on with that? How did that happen? And how do we stop that from happening? Now we're back to disproportionate minority contact, because one of the biggest risk factors for ending up in prison is simply being Black or Hispanic or being poor. Poor minorities do commit more crimes, slightly. Certainly they are caught more often, and it depends on what crime, because actually when you're looking at drug-related crime, white people actually tend to do that more often. But anyway, but that still explains only part of the disparity. What happens is that very small class differences, like around poverty, in offending, then become amplified at each stage. So you have people who are more likely to be monitored by police and therefore more likely to be arrested, more likely to be convicted, more likely that the sentencing is more severe, and so everything just gets magnified all along each step of the criminal justice process. A criminal history then accumulates for a person that reflects not just what bad thing they may have done, but also race and poverty issues. In other words, I'm a 15-year-old and I shoplift a Snickers bar. If I'm a 50-year-old shoplifting a Snickers bar and I'm white and I'm in a middle class, you know, I'm in Urbandale, where I am broadcasting from, probably I'm not being monitored in that store as much as that Black 15-year-old because I'm white. And so I'm much less likely to be caught. But I'm doing the same thing. However, for that person of color, they're more likely to be watched in that store and followed around. They're more likely to be caught, arrested, taught a lesson, et cetera, et cetera. American criminal justice policy frames itself as being based on personal responsibility. You know, you do the crime, you do the time, and as being race neutral and class neutral, but in fact it does not it doesn't operate that way in practice. And all of the questions about, okay, if it is personal responsibility, then why is it that poor people are more likely to make bad decisions, so-called bad decisions? Why is it that the Hispanic kids you know, like here in Polk County, you could say, why is it that the Bosnian kids are more likely to be, quote, making bad decisions than the others? How is it that we are failing them? How is it that they're having more trouble than the other kids staying in school? So if we go back and we take a look at disparities and look at those risk factors, we can see those disparities playing out along every single one of those. People try and explain disproportionate minority contact in a lot of different ways. You see people doing the colorblind explanation. It's individual choices. There are no outside influences. Okay, that's very strange to me. That sounds to me very much like it just automatically leads into a racial or ethnic group explanation of saying, oh, there's some attribute, some stereotype about that particular group that's innate to them, whether it's a cultural innateness or physical even innateness, that makes it so to explain that disparity. Those kids don't do well in school because their parents don't value education. Those kids don't do well in school because that group is just naturally, genetically more violent, you name it. Social or economic class explanations say it's all about poverty. You know, it's all about class but not race. But again, when you remove some of the class differences, we can still see significant race disparity. Institutional explanations attribute disparity to a particular institution's policies. So, well, you know, the high schools here, their graduation rates could be addressed by simply changing their school district policies, and then then all of that would disappear and everyone would graduate at the same rates without looking at the rest of the community's opportunities, and how all of it plays a role into somebody's success. Finally, and of course you know where I would fall, where the coalition would fall, we can look at structural or systemic explanations that say that racial disparities actually result from complex interactions between individual behavior, institutional policies, historical legacies. Racial disparities can result even when policymakers or staff have good intentions, have, quote, colorblind policies that nevertheless, without taking into account all of it, all of those intersections about a person, and where we have come from, you're not getting a clear picture of why those disparities exist. So as I said, let's go back and look at the risk factors for that, what they sometimes call the school to prison pipeline. Poor school experiences, those are going to fall a whole lot more on some kids than other kids. So young Hispanic or African American kids experience significantly different discipline in kindergarten. They're more likely to be suspended from school, even though they do not misbehave any more frequently. They're more likely to be arrested in school, to be assaulted in school by school personnel. Healthcare is worse. Access to treatment is worse. We have a system where, you know, kids in those communities of color are more likely at this point to have criminal family members because they are living with and growing up within the system that for the past couple of decades has been focused on incarcerating as many people from those communities as possible. Let's talk specifically about Iowa. Let me check my time. Oh dear. Let's talk specifically about Iowa for a minute. 3.3% of Iowans are African American, and about 14% of Iowans overall live in poverty, but 39% of African American Iowans live in poverty. Iowans, about a third of Iowans rent their homes instead of owning, but if we look at African Americans specifically, about over 70 to 75% actually are renting. The median income for Black Iowa households is $27,000. For whites, it's $52,000. I know that the economy tanked, but even before the economy tanked in the last 8 to 10 years, blacks were already had an unemployment rate twice the rate that white Iowans did. It was as high as 20% in 2005. I can remember hearing people say, well, we only had an unemployment crisis once white people were unemployed at the same rate at which black people had been unemployed for decades. Health, before the Affordable Health Care Act kicked in, only 44% of black Iowans had private health insurance, compared with 77% of white Iowans. So there's disparity all across the board. 14% of school dropouts in Iowa are African American, and that figure is worsening. 56% of African American students in Iowa perform below grade level, compared with half nationally. So black students in Iowa actually do worse in our school systems than black students overall in the country. Black student graduation rates at 79%, whereas Iowa's overall graduation rate is 91%. So we have some work to do here, folks, some big work. And when we're thinking about what is that school to prison pipeline, what is the source of our racial disparities in our prisons in Iowa, we have to look not just at our criminal justice system, but all across the board. We are, as I said, top in the nation in terms of the number of African Americans that we imprison. Both whites and blacks in Iowa use pot at the same rate, and yet if you're black, you're 8 times more likely to be arrested. And that disparity is the worst in the nation again. So yay, we're number 1. Woohoo. Let's take a look at some of those protective factors. Education, employment. If people are educated, they have access to information and knowledge and skills, they're more likely to be employed and to be employed at jobs where they can actually support themselves. And people who are employed and are able to support themselves are less likely to commit crimes. They are more likely to be engaged in their communities. They're more likely to simply be busy. They are more likely to not have circumstances that create an impetus to commit crime. Similarly, access to substance abuse and mental health treatment. If we could have that in our communities rather than our prisons, we could. This is not only a protective factor in terms of primary prevention, but it's a protective factor in terms of recidivism for folks once we can. Oops, you know what? I'm speaking ahead because I'm already thinking reentry success, and I'll just back up. I'll get to that in a minute. Parent-child attachment, parent engagement, connection to community groups, faith community affiliations, having healthy activities available where you can actually get to them because there's good transportation, it's affordable, things are embedded within communities and they're not inaccessible somewhere else in some other world that's not even part of your neighborhood. Having role models of constructive coping instead of substances or other kind of negative coping skills, all of these things can act as a primary way to prevent that eventual railroad track straight into prison. If we think about what helps people once they've been in prison to go back into communities, Employment and housing are these are the big ones. They're not surprises at all. Again, jobs. Having a decent job makes you feel connected, it gives you self-worth, gives you a sense of hope, gives you a sense that you are contributing, that you have some kind of control over your life, keeps you busy, connects you to other social networks. Employment is huge. And what have we got? We have the box that people have to check on their employment applications that say that they have been convicted of a felony. And that prevents so many people from having the kinds of jobs that would actually lead to successful and permanent reentry in our communities. And that's why we are suddenly now in the last year or two seeing the expansion of a lot of ban the box initiatives, because if we want people to be successful, if we want to stop the loop back into prison, employment is one of the biggest issues. And similarly, housing. It's really hard to be successful when you have no home. Um, it's really, really easy to fall back into other behaviors and other social networks and other sources of support and other coping skills like substances when you have no home, when you have no stability. So we know that that's important. And yet people with records are banned from housing assistance in many of the same ways that they are banned from employment. And not only that, not only banned as an individual from housing assistance, but you'll have somebody who, let's say, is on public assistance, and if I allow my adult son who has been in prison to come and live with me, or even to just come and spend a night or two while they're getting on their feet with me, I might lose my housing as well. Certainly, healthcare, including substance abuse and mental health treatment, if it follows them, it's one thing to get substance abuse and mental health treatment while you're in prison, but what happens once you get out? Connecting people to mentors in the community so that they have new social networks. It's all about attachment, folks. Quite often it is about attachment and whether or not you feel like you are part of something or whether or not you feel you are isolated. We can talk about recidivism data. In Iowa, there have been, particularly in Des Moines and Waterloo, some really intensive efforts focused on reentry for African American prisoners, and that has shown some impact in declining reentry stats for African American prisoners in particular. New strategies that corrections has been using, like hiring a more diverse workforce all across the board, has been having an impact in reducing recidivism. Generally, there's a 30% return rate, as they call it. Violent offenses have and always have had the lowest recidivism rates. Iowa and 4 other states have received a big chunk of federal money, $3 million over 3 years, to create and implement a strategic plan to reduce recidivism. So we are in the middle of that. We got those funds in October of 2014, and so a lot of the research parts have happened and the planning is well underway in terms of reducing all across the board. And we'll see what our state and what other states come up with as outcomes. As I said, the focus is things on reentry and intensive, like one-stop shops, if possible, in communities that can have those, where that offender has one place they can go where they can deal with their housing and their health care treatment and their employment and you name it. and their probation supervision, parole supervision, things like that. Having more diverse staff, doing better assessment up front as far as what people need and making it be more personalized instead of the one-size-fits-all. So that will be interesting to watch, the outcome from that. The governor set up a group, a working group on justice policy reform to do a study and then create a report on what needed to be done, and that report is available online, and basically it has 4 recommendations saying that we need drug courts and mental health courts, basically acknowledging, like most of the rest of the world has, it's like most of the rest of the world has acknowledged that our treatment of addiction has is a train wreck, and that it needs massive overhaul, and that addiction should not be a crime. And at the same time, even though we have this awareness, we still seem to be unable to quickly change course, and we seem to be unwilling to give up the idea of criminalizing addiction somehow. So, okay, we're going to treat people differently, but we're still going to have a drug court. But so having specialized courts, having more diverse juries, just like diversifying the correction staff seemed to make a difference. Let's diversify our jury pools. Doing a better job of maintaining the confidentiality of juvenile records, because people were finding that things that were not supposed to be made public were being made public, and things that were not supposed to be impacting later decisions were impacting later decisions. And then this is, to me, was interesting because it is so specific, and I understand it. The cost for prisoners and people in jail to talk to their loved ones was extremely high, was prohibitive for many people, and a very specific thing they said was we need to change the way we need to change how that's done, and we need to make it cheaper and more accessible to people. That makes sense to me. It's interesting that if prisons have been set up as a way to isolate and incapacitate people from the public, what they're finding works best as far as reentry and preventing recidivism is to make it more easy to have contact. Those two things don't seem to go together. But yes, that ability to maintain social connections, that ability to talk to people and prepare for your reentry, that ability to not be cut off and feel cast aside, to continue important attachments is crucial. And so, how can they facilitate it? They can simply make it so it's affordable for people. Come on, didn't want to move to the next one. Okay, I am out of time. Almost, I guess, well, I'm out of time. But I do want to say, this is my last slide, that almost every single thing I have said really applies to male offenders and not so much. I haven't spoken specifically to female offenders who are sometimes a slightly different issue than male offenders. There are 7,000 to 8,000 men incarcerated in Iowa, and there's 700 to 800 women at any particular time. And it is true that the incarceration rate for men exploded in the last couple decades. It doubled in the past 20 years, but the incarceration rate for women in the same period quadrupled. Women in prison are far less likely than men to have criminal histories. Half of incarcerated women have no or only one prior offense. 3 out of every 4 women offenders serving time for a violent offense committed simple assault. 62% of women offenders serving time for a violent offense had a relationship with the victim as an intimate relative or acquaintance. 60% of women in prison for murder murdered family or partner. In other words, there's a lot of survivors, and there's a lot of self-defending survivors that are in prison for a long time, and sentencing and sanctions tends to fall extremely heavily on women. Half of women in prison, as opposed to 13% of men, were physically or sexually abused prior to being incarcerated. 30 to 40% of that half say the abuse occurred during childhood, or at least began during childhood and is quite likely to have continued. And so that raises the question of, oh my gosh, if you want to go out and find a population of survivors of sexual and domestic abuse in Iowa, where should you go? The answer is our prisons. So are we serving them, and how does contact with our criminal justice system re-victimize those survivors? How does it punish women for their victimization? How did our systems fail them in a way that instead their survival tactics were framed as crimes and they ended up in prison? So for women, what we see is that one of the main pathways to prison is childhood victimization. And that often can contribute to mental illness and substance abuse. There's a relational pathway where women are coerced into crime, or they are defending themselves, or that relational violence reduces their self-efficacy in other ways to get their needs met. There's challenges for women in areas of education and disparities in education and family support and employment. All of those things can contribute to subsequent imprisonment. Women offenders have about a 25% prison return rate as opposed to the 30% overall. So I haven't spent much time talking about female offenders, but that's certainly something that's worth taking a look at. And for us as service providers to victims, that is something that we need to seriously take a look at. And now, I may only be 4 minutes late, but I am done speaking. I have not seen any hands go up. I will pause now in case you do have a comment. And I will remind you that there are handouts there available to download if you choose. You'll have to click on them to download them yourself. They aren't sent automatically to you. And I will stop the recording and I will get this uploaded, and I will thank you for, oh, there's a hand. Nope, no hand. Alrighty. Thank you for spending your afternoon with me, and I will see you at the next webinar.